Welcome to our channel. Today, we discuss a topic that's equal parts urgent and unsettling. Why the next pandemic could be far deadlier than anything we've seen before, and what you can do to prepare. COVID-19 was a wake-up call, but experts warn it was merely a dress rehearsal. From mutating viruses and antibiotic resistance to climate change and global complacency, the ingredients for a catastrophic pandemic are simmering. Let's dive into the science, the risks, and the steps we can take now to protect ourselves, our families, and our future. First, let's rewind. COVID-19 infected over 700 million people and killed nearly 7 million worldwide. It overwhelmed hospitals, crippled economies, and exposed glaring flaws in global preparedness. But here's the chilling truth. COVID-19 wasn't even close to the worst-case scenario. The 1918 flu killed 50 million people. Smallpox wiped out 300 million in the 20th century alone. And today, thanks to modern factors like hyperglobalization, deforestation, and antibiotic overuse, the next pandemic could eclipse them all. So why will it be worse? Let's start with pathogen evolution. Viruses and bacteria are masters of adaptation. Take influenza. It mutates so fast that vaccines need annual updates. But imagine a virus with COVID-19's contagiousness, Ebola's lethality, and measles are zero. A single person infecting 18 others. This Disease X scenario, a term coined by the WHO, isn't science fiction. It's a placeholder for the unknown pathogen scientists say is inevitable. And with humans encroaching on wild habitats, we're playing Russian roulette with zoonotic diseases. Bats, rodents, and primates harbor thousands of undiscovered viruses. One spillover event, a bushmeat market, a deforested farm, could unleash chaos. Then there's antibiotic resistance. Imagine a pandemic where even bacterial infections become untreatable. Superbugs like MRSA and drug-resistant tuberculosis already kill 1.3 million people annually. Overuse of antibiotics in farming and medicine is accelerating this crisis. If a deadly bacterial strain goes airborne and resists all drugs, hospitals could become death traps. But the scariest wild card? Climate change. Rising temperatures are expanding the range of disease-carrying mosquitoes, ticks, and rodents. Dengue, Zika, and Lyme disease are creeping into new regions. Melting permafrost could unleash ancient pathogens, like the 30,000-year-old zombie virus, revived from Siberian ice in 2023. Warmer oceans are fueling toxic algae blooms, while extreme weather disrupts sanitation and displaces populations, creating breeding grounds for outbreaks. Now, layer on human behavior. Pandemic fatigue has left many indifferent to warnings. Vaccine hesitancy is rising, fueled by misinformation. Supply chains remain fragile. During COVID, even PPE and oxygen ran short. And global cooperation. It's crumbling. Nations hoarded vaccines, and geopolitical tensions stalled data sharing. In the next crisis, this every country for itself mentality could be catastrophic. But it's not all doom and gloom. The silver lining? We've learned from COVID-19. mRNA vaccine tech proved we can develop shots in months, not years. Wastewater surveillance now tracks outbreaks in real time. AI models predict viral mutations. The key is acting now, before the next threat emerges. So how do we prepare? Let's start at the individual level. Build a pandemic kit. N95 masks, sanitizers, a 30-day supply of meds, and non-perishable food. Stay informed through trusted sources like the WHO or CDC, not social media algorithms. Advocate for clean air infrastructure. HEPA filters and UV lights in schools and offices reduce airborne spread. And talk to your family. Draft a plan for lockdowns, remote work, or caring for sick relatives. On the community level, pressure leaders to invest in healthcare. Hospitals need surge capacity, stockpiles of PPE, and trained staff. Schools and businesses should have outbreak playbooks. Support local food banks and mutual aid networks. They'll be lifelines during shortages. Globally, we need equitable vaccine access. During COVID, wealthy nations hogged doses while low-income countries waited. This isn't just unethical, it's stupid. Viruses don't respect borders. The next variant could emerge anywhere. Organizations like CEPI, Coalition for Epidemic Preparedness Innovations, are working on vaccines for unknown pathogens. Fund them. Governments must rethink containment. Early detection is critical. Expand testing labs in rural areas. Train virus hunters to monitor wildlife and farms. And penalize misinformation. During COVID, conspiracy theories killed people. Platforms must prioritize facts over clicks. But what if the worst happens? Let's game it out. A novel bird flu strain jumps to humans. It's airborne, deadly, and vaccines take a year to develop. Hospitals overflow. Schools close. Supply chains snap. How do we survive? First, mask early, mask right. Studies show high-quality masks cut infection risk by 80%. Avoid crowds. Work remotely if possible. Second, trust science, not influencers. Wait for peer-reviewed data before guzzling unproven cures. Third, protect the vulnerable. During COVID, 75% of deaths were among those over 65. Advocate for prioritization of elderly and immunocompromised. Now, the big question, will we act in time? History says no. After the 1918 flu, we dismantled pandemic systems. After SARS in 2003, funding dried up. COVID-19 sparked temporary urgency, but already, budgets are shrinking. The U.S. recently slashed its pandemic preparedness funding by 50%. This cycle of panic and neglect is a recipe for disaster. But here's the good news. You have power. Vote for leaders who prioritize public health. Support scientists, not conspiracy peddlers. Invest in community resilience. And stay vigilant, because pandemics aren't once-in-a-lifetime events anymore. They're the cost of living in a hyper-connected world. If you're feeling overwhelmed, you're not alone. But preparation isn't about fear. It's about empowerment. Start today. Update your emergency kit. Learn CPR. Plant a garden. Small steps build collective resilience. If you found this deep dive eye-opening, hit that like button, subscribe, and ring the bell. Drop a comment. What's one thing you'll do this week to prepare? Let's crowdsource hope. Thanks for watching, and remember, the next pandemic isn't inevitable. Our choices today will decide its course.